high and low. I'm 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 high and low.
Thanks so much. It's a pleasure to be here and to be able to talk about ASAP, its agenda, and the MDGs. Can you hear me? Yeah? I have no visuals apart from myself, so I hope that'll be enough for you. As we just heard, the MDGs are about to expire in a couple of years. There is a discussion underway to understand what MDGs 1.0 did well, what they didn't do well, and what MDGs 2.0 should look like. The retrospective views on MDGs 1.0 include many of the suggestions that you heard from Thomas and Gilad. There may have been a misspecification of some of the targets and goals. The process was not particularly inclusive and participatory. There was an absence of accountability in their implementation. And there was, in addition, the fact that a number of important social goals were missing from the list. Climate change, human rights, governance. We heard something about cultural preservation earlier, a wider view of feminism. All of these things are on the table, and people are talking about what should be added, how we should do it differently, both in the process and in the accountability, and what the numbers should look like. Now, to me, it's quite striking that these discussions of MDGs 2.0, for the most part, are talking about the content of what the MDGs should be, as well as the process that leads up to them. I think it's also important to talk about the form. And what I mean by form is the following. The MDGs were partly a new conception of development, forwarded to some extent, stand as an alternative view to the Washington Consensus. But they were also, and Sakiko has written about this, an incentive scheme. They were designed to incentivize countries, the world, individual actors, private actors, do certain things along the dimension of human development. Now, the incentive scheme was, as economists would say, low-powered. It relied on interagency cooperation, goodwill, a little bit of naming and shaming through reports, monitoring, some data. It wasn't a hard incentive scheme. It wasn't like high-powered incentives. This is related to the accountability discussion that we just had. Now, I think what I want to emphasize is that, for the reasons that I will elaborate in a couple of minutes, a low-powered incentive scheme for this kind of agreement is inevitable. It's likely to be the case for MDGs 2.0 as well. We need to accept that and incorporate it. Now, given that you have a low-powered incentive scheme, it's not the case that all low-powered incentive schemes are the same. Some have more salience, some resonate more, some motivate more than others. If you don't believe in an afterlife, the 10 Commandments are a low-powered incentive scheme. They sort of work. Some other kinds of low-powered incentive schemes don't resonate. And what I want to emphasize in the next few minutes is that we need MDGs that nudge. And you may know the book by Sunstein and Thaler, which describes how even when you have low-powered incentives, you can structure the choice architecture in such a way as to promote socially desirable objectives, using opt-outs rather than opt-ins for retirement savings, for instance, is one of their key examples. Now, that motivates private behavior, and the MDGs are partly about public behavior, so it's not exactly the same. Nevertheless, I think we should think seriously about salience when developing these indicators and targets and goals. And we should think about MDGs that nudge. And so I want to, in the next few minutes, make that argument in 3 steps. First, I want to talk about what the MDGs were. Second, I'll say something about what I think is their best analog, which I think are the international human rights treaties and agreements. And third, I'll give you some examples of nudging. So what were they? It's actually easier to say what they were not than to say what they were. They were not a treaty. They were not a formal international law instrument. By that, what I mean by that is that they didn't pass the test of what international political economy scholars talk about when talking about legalization in the international sphere. You have a legalized international regime when you have obligations, delegation of authority to supervise the obligations, and precise actions. I think the MDGs failed all of those tests. There were no legally adopted obligations in the sense of a treaty. There was no process for accession, ratification, no process for reservations, nothing about withdrawals from this treaty regime. That didn't happen. There were no obviously delegated organizations to monitor and sanction failure to reach these targets. We heard something about that accountability scheme as well. Now, a number of agencies did monitor. My own, the World Bank monitors, the UN agencies monitor, country governments, a number of NGOs, but no one entity that was really in charge of monitoring and then especially sanctioning. And then finally, and somewhat ironically, it was imprecise. Ironic because there were these precise numbers, as we heard, cut by half the portion of the world's poor living under $1.25 a day, targets for child mortality, maternal mortality, like the number of slum dwellers whose lives were improved. Despite these precise targets, there was a lot of imprecision, and the imprecision had to do with a number of factors. To begin with, some of the entities, some of the actions necessary to achieve these goals were in the hands of private actors or external actors, and not just national governments. It was unclear whether these targets were average targets for the world or minimum targets for each country. The latter interpretation finally seemed to sway, but it's really ultimately unclear. People talk about it through both lenses. It was clear, as I mentioned, that some actions necessary were beyond the control of national governments, and there was always an alternative, an out for governments to say, well, we can't really do that. What can we do? The costs for achieving these varied with the baseline level. Marginal costs depended on the baseline level of poverty, the baseline level of mortality and education. There was a mismatch between some of the goals and the specified targets. And then finally, for MDG 8 on global cooperation, it uniquely was not quantified. So for all these reasons, there was a lot of confusion about the clarity and precision of the targets relating to MDGs. Now, this is true. I think this is unavoidably going to be true. What you need for a legalized international regime is a case law. You need an entity interpreting for you. Whatever targets we develop are going to require interpretation, adaptation, understanding, and not necessarily in a pejorative sense, not the creative accounting that Thomas was describing necessarily, but any legalized regime requires interpretation. And you don't have that if you don't have a delegated entity that's in charge of doing this. So, what are the prospects for getting a more legalized MDG regime in 2.0, in the next round? Not high. The reasons for this is that when IPE scholars look at which regimes around the world, which international law regimes are particularly legalized, they find that there are two things that push for legalization. One is the propensity to shirk. If you think another entity, another state is going to shirk in providing this shared good, you want to watch them carefully. You want to delegate responsibility and monitor carefully. That's true. There is a propensity to shirk in something like this. But it also is more strongly related to the self-interests of the states. And it's simply not the case, in my view, that most states put global poverty very high on their list of objectives. Other things like external security, domestic law and order, economic growth, domestic equity, and identity recognition just figure higher in the priorities of most states. That's not the way we want it to be, but that's the way it is. And we need to incorporate that fact. So, low levels of legalization are likely to continue in MDGs round 2.0. That's point number one. Now, the second point I want to make, the second part of this little talk is about the best analog, which are international human rights treaties. Now, with apologies to some of the international human rights lawyers who might or might not be in the room, these are also not highly legalized. The obligations for these treaties, like the Convention on the Rights of the Child, the International Covenants on Economic, Social, and Cultural Rights, you know the list. these treaties do have formal processes for ratification, for putting in reservations for withdrawals, things like that. So they meet that obligations test. However, the delegation is given to, although there are committees attached to some of these treaties, the monitoring falls to a number of NGOs, Human Rights Watch, Amnesty International. I'm being sanctioned for my time. A number of entities like that, and none of them have the power to sanction per se. And then finally, what the precision, of course, is quite not entirely clear. Some of the rights conflict with each other. What actions are required are a little bit unclear. I can say more about this in Q&A if you like. So if you buy that, the international human rights regime is the analog, then you have to think about, well, how does the international human rights regime work? Now, we don't think it's useless, and there are studies, econometric studies that look at the impact of ratification on contemporaneous measures of things like torture, of child vaccination, and find that, in fact, it does have an effect. These, I've done some of this work. Some of the most comprehensive work is by Beth Simmons at Harvard. So we know they have an effect. We also know in a more qualitative way that these treaties affect mobilization. Some of the language of, say, the Universal Declaration of Human Rights shows up in the Constitution of South Africa. So they affect people. Now, they work through three mechanisms. One is through bureaucratic entrepreneurship. Two is through the judicial application of these treaties at the domestic level. And third, most especially, through social mobilization. So even though they don't have a lot of legalization, they operate through these mechanisms. Now, why is that? It's because they have a lot of resonance. If you think about the constitutional revolutions of the 18th century and 19th century, if you think about some of the work that Lynn Hunt has done on the sort of the artistic experience of the person and individuality, there's a whole global memory of what human rights means. So every time you see a report that uses words like torture or dissidence or human rights violation, there's a global memory that it's drawing on. The MDGs are not like that. They're much more technocratic in their targets. And for that reason, it's not terribly surprising that they didn't necessarily achieve their results. Of the 21 targets, only less than 2, maybe say 2.5, are likely to be achieved. But that's not to say they didn't have some effect. They led to more talking. They led to more aid flows. They did some mobilization. That's what they can do. My point is that the only thing the MDGs can really do is mobilize. And often the lamentation is, oh, it's just talk. But what I want to say is, I'd say in Silicon Valley, that's not a bug, it's a feature. And we need to take that feature seriously in the MDGs app. Okay, so nudging. 3 kinds of nudges, right? Psychological salience, moral salience, political salience. On psychological salience. Daniel Kahneman, in his book, Thinking Fast and Slow, Reviewing the Evidence, makes the point that facts and data that are cognitively easy feel familiar. And things that are familiar have the ring of truth, even if on careful demonstration they're not true. If you take that seriously, what we should do is think about things that are relatively easy to understand. So for our targets, let's get rid of the large numbers, let's get rid of the proportions, things like that. MDG 8, as I mentioned in global cooperation, did not have any quantified targets. But people often do talk about the 0.7% of GDP that countries ought to be donating in ODA. Now, do you really know what 0.7% of GDP is? Does your mom, does your aunt, does your uncle? How big a deal is it if it goes from 0.6 to 0.7? Does that mean a lot to you? Not obvious. So what I think we should do, for instance, we should do something like share of tax dollars per person in each country that go to ODA. $20 per person in the United States, $130 per person in Norway. You can compare that to your other expenditures. That's the kind of thing I mean by psychological salience. Infant mortality rate. Do you know what that is? Is going from 300 to 280 as big deal as going from 30 to 10? Do you have a feel for that? Maternal mortality ratio. Why is it a ratio and not a rate anyway? And why is it deaths per 1,000? Is it 100,000? Do you remember that? I don't think these numbers have a lot of salience. For the health indicator, we need something like lifespan. right? You have a feel for how long people live. That could get people talking. Now, we can talk about life expectancy. Life expectancy is more technical, and it emphasizes the early years of life. We could have a weighted average over all demographic cohorts. There are ways to sort of, to sort of develop what an average lifespan, the lifespan of people who are currently living. We could use that. So that's another idea. Carbon emissions. 1,000 metric tons of carbon dioxide equivalent emissions. Do you have a feel for that? I don't know. But even 2 degrees centigrade, does that seem like a lot to you? It doesn't seem like it's a big difference in temperature. So how about millimeter increase in sea level? That's something you can feel. In addition, it embeds within it the causal narrative about why carbon emissions might be bad. There are others I can suggest. Universal literacy, I think, makes sense for education. Now, causal narratives, I think, are also crucial. I'm going to take a couple more minutes, if that's okay. Causal narratives are also crucial because people need stories. The MDGs were just a list. Now, when it comes to causal narratives, when you ask people what they think about development, what they think about, most people, according to a study by Darnton and Kirk, is corruption. That most people think that development isn't working because of corruption around the world. And the MDGs need to take that on with, I think, a transparency corruption indicator so as to confront it directly. Let me quickly run through the other points because I'm just about out of time. By moral salience, what I mean basically is the idea that if you think about the big moral revolutions, abolition of slavery, decolonization, Appia talks about foot binding, these are about saying no, right? And Gandhi, for instance, developed non-cooperation, was very good, very insightful about the importance of saying no. He said, rejection is as much of an ideal as the acceptance of a thing. It is necessary to reject untruth. It is as necessary to reject untruth as it is to accept truth. We had lost the power to say no. So we should construct these as saying no. Now, Thomas makes the argument that morality itself has higher standards for action when related to not harming than to doing good. I don't necessarily want to make that point, but I do think it's certainly more morally salient. So we should write these in words like avoid further impoverishment of the poorest people in the world when it comes to trade barriers. Stop exposing the world's most vulnerable to droughts, floods, and storms. Release all information that helps people make economic and social choices for themselves. Avoid saying no. And finally, political salience. The MDGs were developed outside the state system. It's states in the world that have much more legitimacy than the international civil servants. And we need to draw on them to develop these targets. So the idea here is to say to states, come up with your own targets. Ratify them. But if you don't, we'll use the international targets. So there'd be a default for them that would be used otherwise. And the idea here is built on the fact that ethical argumentation to be accepted depends on getting into a good venue and on the legitimacy of the person talking. And it's states much more than people like world bankers who have legitimacy in the eyes of most of the world's poor. So there are a lot of things that we can't do to generate generosity and empathy in the world. Self-preoccupation is a failing of human nature. But there's certain things we can do, like making the targets less technocratic, like making them more morally salient and making them more politically salient as well. Thanks.
So I'm going to be talking about sort of like an overview of how I see this MDGs as a phenomenon in international relations, political and economic relations between rich and poor countries. I'm not sure how do I change the, do I use this? I see. Okay. So as we've already heard, this has become this framework, this MDGs have become accepted as this a sort of a substitute, a shorthand to mean a consensus on what development should be all about. And I'm not sure that I agree with Varun when he says that, MDGs have no salience, because it is quite unprecedented in the history of trying to make consensus development agendas stick, that we have come this far with the MDGs. I mean, the UN, starting in 1960, has been trying to develop these consensus agendas. The 1960s, first development decade, the 1970s, second development decade, and so forth. And I'm sure you haven't even heard about them because they had so little salience. So what did they actually do in terms of changing ideas about policy agendas and how we understand development? And what was some of the politics that drove this thing? So here are some basic sort of background information, the way I see this. And so they were an important consensus. I think they did, there again, I'm not sure I agree entirely with Varun that they didn't, they were not effective. I think as, what did you say, low power incentive, I think that the one thing they did is to mobilize support and draw attention. And, there's an awful lot of debate about whether they are going to be achieved or not. I think this is almost like a silly question. And I think because I'm not sure that even the framers really expected them to be achieved. I mean, they were, we know what the progress with poverty has been, but it's impossible to attribute them to the MDGs. So what I think is important is, in terms of the ideas behind MDGs is that there was in 2000 this very important declaration, the Millennium Declaration, and most people have forgotten the fact that the MDGs were not really the important things that were agreed. It was what was agreed internationally was a Millennium Declaration in the Millennium Assembly of 2000 when world leaders came together to adopt a vision for the new century, if not the new millennium. And they said very clearly, we will spare no effort to free our fellow men and women from the abject and dehumanizing conditions of extreme poverty. And it had also very, very important principles enumerated in the first chapter of the declaration, and they underline the principles of international solidarity, equality, dignity, and respect for nature as something that would drive this mission. And this document identified development as one of just one of the four priorities. And they also set these concrete goals that then turned into the MDGs, but they were not actually the MDGs. And I'll get to that later. The problem is in the intervening period, I think we've learned an enormous about the numerous flaws that were in the MDGs as they were specified. I mean, we've heard a lot about, the problems of accountability, that they were not designed to hold anybody to account. But I look at it in a slightly different way, I think. I mean, as in purely sort of economic terms, they're simply not a reliable framework for evaluating development process. And many people have written about that. I mean, the way in which that they were defined were inconsistent. There was no consistent methodology. Easterly has written about that. As I have already mentioned in the little conversation earlier this morning, there are, hideously biased against the countries that are starting very low, the poorest of the countries that need these goals most. And moreover, they are set at levels that are historically unreasonable to achieve by historical standard. So it's really setting poorest countries up for failure. And more important, I think they can also distort national processes and priorities, because here you had this gathering in New York deciding for the entire world, for Burkina Faso and Maldives and different parts of India and China, exactly what that one-size-fits-all plan is. I mean, this is sort of an absurdity if you think about it. It's almost like Soviet central planning that tells each factory what to produce. Well, here's a General Assembly that told each country what what pace of social progress they should make. We know that development planning should not take place in that way. I mean, this just really, and so the development planning, resource allocation, the way that you plan public investments, and a multitude of other things is not to be done by somebody sitting in New York and doing it for the whole world. It goes, it is, we know that you do it from a more bottom-up process and a technically robust process. Now, the other problem, the main problem I have with the MDGs is that they are incredibly narrow in scope, and that's another way of saying this is a simplification, an absolute simplification of the vision of development and the social objectives of the future. And this is a very clear why this happened. I mean, we know, for example, that there are an awful lot of things that are left out of the MDGs, like employment, like equality, like climate change, like democratic governance, like security, global governance, many, many other things. There are also, no time-bound quantitative targets for Goal 8, we know that. They are inconsistent with some human rights standards. But most of all, they are sort of a simplification of what we have understood in the 1990s as a process of development. Even the 2000 World Bank the World Development Report published by the World Bank, not the human development, but by the World Bank, says, what do you need to do for poverty reduction, empowerment, opportunity, security. It was not simple formula of social investments and employment creation, which was the sort of the agenda of the 1970s and 80s. By 2000, a lot of thinking and analysis about development and poverty reduction made very clear that the process of poverty reduction was a sort of a transformative process. It had a lot to do with people's agency, opportunity. It had a lot to do with security. This sort of complex thing, and none of those things were in the MDGs. And one simple reason why this is, I think Gilad mentioned at the very beginning that you had this sort of global conferences of the 1990s that set up a sort of vision and an agenda, and they kind of synthesized and summarized everything. So you had in Beijing in 1996 a very wide participative consultation about women's equality and development. Well, there was a 13-point platform adopted at Beijing, very broad about, equality at work, equality in political participation, domestic violence, all sorts of things. Well, there is only one target initially that was adopted. That is equal enrollment in primary and secondary schools. And so this extreme narrowing down of the agenda, this transformative agenda into these silly goals, sort of ended up kind of dumbing down the whole development vision. And I think this is really a serious problem. And why did that happen? It's because nobody who was, formulating the MDGs ever thought that these goals would be taken so seriously. They were set as monitoring indicators. They were not set as priority objectives, important social objectives. They were set as kind of, a set of certain indicators you might use to monitor progress. And these are two very different things. And, there is this flaw about this ambiguity about whether they should be applied at the national or the global level as well. So how did this happen? Now, what were the politics that produced these goals? I think this was an attempt in the international community to build consensus and go over the divides over structural adjustment, Washington consensus in the 1990s, because 1990s was a period of decline in support for aid. Therefore, development ministers, I'm sure this is true in Canada, in the US, everywhere, Clare Short in the UK, faced this problem that they wanted to have increase in development budgets, but they were faced with a development community of NGOs, politicians, academics, all fighting over the appropriate policy approaches, right? And so you couldn't sort of unanimously join together in fighting for more aid if you had disagreement within. And so it was very convenient to have this nice set of things that no one could disagree on, and get agreement on it. And of course, there were other things like that the UN was very keen on reclaiming global leadership on development discourses, and and it was, and there again, I mean, I think Varun does sort of the glass half empty story by saying that they had no salience, because compared to reading, poverty reduction proceeds through economic growth, and is it trickle down, blah, blah, blah. I mean, putting every child in school was a pretty salient kind of a message. So I think this was not a bad message. So I think it's this power, the communication of power of numbers and quantification, I think went at least half the way. I mean, I recognize the shortfall, I think Varun is talking about the glass half full, but I think of it as glass, half empty, whereas I think of it as glass half full, that compared with the very contorted definitions of development and poverty, I think that the goals were concrete, and therefore they communicated well. Now, the problem is that, maybe I should go on since I'm running out of time. So what did they actually do when they sort of hit the road? Well, I think there was this distortion, there was this kind of a hijacking of the 1990s agenda as developed in Beijing and many other places, an alternative to structural adjustment programs and the Washington consensus policies that emphasize participation, equity, inclusive globalization, partnership amongst different stakeholders, and Amartya Sen's ideas about human well-being and dignity, and human rights ideas about dignity and freedom as essential aspects of development goals. And you have this sort of dumbed-down agenda in the MDGs. And then how did they get implemented? Well, one of the things that I did was to actually analyze 22 existing PRSPs and 21 donors' policy statements a couple of years ago. And what you found was that most of these rhetorically talked about the MDGs, and in a somewhat a mechanistic way even set goals, sort of like, just mechanistically interpreting the quantitative targets and sticking it into national frameworks. And they emphasized growth and income poverty, but they didn't emphasize many other things that are important: employment, hunger, nutrition, gender equality, environment. So, I mean, there was this very strange phenomenon where the transformative agendas, the thinking about development as freedom, understanding of poverty reduction as requiring empowerment and agency, sort of became this, cost and deliver basic needs material agenda. So now let me go on then to what this has meant for the North-South relationship. I mean, I don't think it really did what the people in the 1990s were trying to do in promoting in fighting against Washington consensus ideas, policy agendas, or in fighting for more sense of a more inclusive global world. you had an international aid architecture which stayed essentially the same, but with a different kind of a narrative, you know? So, you know, you've had a lot of aid, dialogue about ownership and mutual accountability, but that became defined as using the MDGs as objectives, and you were held to account for achieving the MDGs, and instead of you know, macroeconomic reforms and liberalization and stabilization, you had achieving the MDGs, nice social goals. PRSBs became the instrument for setting out the purpose of, you know, what governments themselves would want on poverty, and this had to be endorsed by donors. And so instead of the previous architecture where you had the policy framework papers that were agreed between the bank, IMF, and the government, you had these nice PRFPs, and there was no conditionality in many of the World Bank loans, but the conditionalities then became embedded in the IMF agreements and the debt reduction HIPC agreements. So you basically had the same elements of the Washington Consensus policies, the policy reform conditionalities for financing, and national policy frameworks, but they were given different names and slightly different authorship and different sort of instruments. So I am out of time. So what I just want to, I want to emphasize is that when we talk about global goals, they are a policy instrument. They are, as Varun said, an international policy instrument that create incentives with low power. And the problem with them is that they are set and used for all kinds of different purposes. They were set, I believe, for the purposes of communicating, for increasing that, as an incentive policy for people to take action in diverse ways. Some people, starting with Jeff Sachs, interpreted them as planning targets, that they had to be absolutely achieved in every single country in the world, and then the people, you know, the government should be held accountable to achieving them. And then, so then you expose all of the contradictions. And then some of them are used as monitoring framework for tracking progress. And I just want you to know that the MDGs were introduced in 2001 in the Secretary General's report for the implementation of the Millennium Declaration, and that they were introduced for the purposes of harmonizing reporting. MDGs were never initially an international agreement. They were introduced by technocrats to harmonize reporting for monitoring progress in implementing the Millennium Declaration. But somehow they have taken a life of their own, and and they have become these kind of normatively defined important ethical goals. Thank you.
So, first of all, it's my pleasure to be participating in this conference, and I think Thomas Pogge is one of the most important and formidable intellectual leaders on the planet, and the ideas that he has expounded over the last 15 years or so have had a radical and powerful influence in terms of how we think and actually act around international development. So it's very much a pleasure to be his guest here today. Thomas has asked me to talk about global health in the context of the Millennium Development Goals. So that's what I'm going to do, I think. I'm going to try to do three things. One is paint a picture of the political context within which global health has been pursued since the end of the Cold War. I'm going to use a very broad brush to do that, but I think it's quite important in light of the conversations earlier today. One of the comments that came from Kairos, which I absolutely agreed with, was the importance of recognizing the political context in which we're actually trying to engage this issue. The second thing that I'm going to do is identify an issue that I think is fundamental to any new vision of the future as it pertains to health, and that is the effect of climate change on health. And then the third thing that I'm going to do is I'm going to highlight a couple of key issues that I think are quite important and that actually resonate with some of the issues that have already been discussed this morning. Now, Charlie Brown was a very famous philosopher, and he said many, many things. But one of them was that I love humanity. It's just the people that I find difficult. I think that in many ways actually characterizes what has happened with the Millennium Development Goals, that they are great rhetorical devices. They have become very powerful normative ideas that have rhetorical resonance, but in practical terms and in terms of their impact on people's daily lives, they really have failed to achieve their stated impact. So in a nutshell, we're very much today two worlds. We're a world where in Canada and the United States, life expectancy is 80 and rising. In the southern region of Africa, life expectancy is 40 and falling. This is a simple but very powerful marker of the egregious inequity that actually exists in the world. Now, when we think about global health, it's a very, very, from an academic perspective, potentially complex area or domain to define. And many great efforts have been initiated over the last particularly 5 years to try to codify a core definition. I won't go through all of them. I've given many lectures on that process and on the content. But I'm going to give you my definition. My definition of global health is simply here. Global health, in my view, connotes a well-being in a state of justice. It's not a technical definition. It's an aspirational and justice-oriented and morally rooted definition that has political, technical, and social implications for how we actually design the function, if you will, of our individual and collective societies. And the idea of global health is fundamentally rooted in the societal determinants of health. This is a concept that I think really does need to be front and center in terms of where this initiative goes forward, in terms of where it goes. There are many experts here in the room on the societal determinants of health, so I won't give you an overview of what that means, but implicit in the definition is that the structure and the function of society in all of its various forms are the primary determinants of health and well-being. It's not access to medicines. It's not access to the latest and greatest healthcare technology. This is not to say that medicines and healthcare technologies are unimportant. They are extremely important. But it is the rules of access, as Thomas has already pointed out earlier this morning. It's the rules that govern access, the rules that structure institutional frameworks that define, in the most practical terms, health and well-being. Now, since the mid-90s, we have seen a global health revolution. We've seen an increase in the number of international actors, from civil society organizations to states to international government organizations to foundations and to one-man states like Bono, who have had an enormous influence on our conception and our practice of global health. We've also seen a massive increase in financial resources and money. From 1990 to 2005, we've seen an increase of $5.6 billion on health expenditures in 1990 to over $20 billion by the first decade of the 20th century. We've also seen a coalescence of institutions around the concept of global health. Institutions like the World Health Organization, UNDP, the General Assembly itself, even the Security Council has, for the first time in its history, debated a global health issue as a human security and as a state security issue. And that was in 2001, and that was HIV. We've also seen several major UN General Assembly meetings focused on health issues, the most recent being September of last year, focused on non-communicable diseases. We've also seen new institutions. UNAIDS was created to deal with the particularities of the HIV/AIDS epidemic in the late 90s. The Global Fund for AIDS, TB, and Malaria was created in the first decade of the 21st century, specifically to deal with the communicable diseases of HIV, TB, and malaria. We've seen new institutions, UNCTAD, formed to fund and to direct funds around pharmaceuticals. Those are the formal institutions. We've also seen new institutions or new organizations or new initiatives around public-private partnerships and product development partnerships, many of which have been highly effective. Few of which have been highly effective, many of which continue to trottle along, hoping to achieve some degree of effectiveness. We've also seen massive coalescence, if you will, and coherence around global health policy internationally, with codified definitions around some of the Millennium Development Goals, which have had some, I have to be fair, have had some positive impact in the developing world. But overall, the impact of these kind of initiatives have been profound. We've also seen civil society organizations mobilize into transnational civil society networks that have had massive impacts through the political process. And I think that's the key point that I want to make. They've had a massive impact through the political process on practical reality for people's access to health care in the developing world. And the best example, and not the only, but the best example of that is the HIV/AIDS pandemic. In 1998, 400,000 people had access to antiretrovirals. But the vast majority of people, the 2-point-something million people at that time, who, in addition to that 400,000, who needed access to medicines, antiretrovirals, were in the developing world and not in the North. Through an international coalition of civil society organizations, that situation has fundamentally changed. Today, the price of antiretrovirals has fallen from $15,000 per patient per treatment per year for the rest of the patient's life, which was the number back in 1998, to less than $64 a year for access to generic versions of medicines that were previously only available under patent. There have also been, even with that success is limited, and is limited to access to first-line medicines. The change in the rules, the change in the institutional architecture that actually governs access, not only to medicines but to other healthcare technologies and to healthcare systems, those institutions have not fundamentally changed. So I would say, if I had to evaluate the Access to Essential Medicines campaign that MSF started, I would say it is a rhetorical success with one practical outcome that could be marked as a success. But in the main, in terms of actually achieving long-term sustainable change, it is a failure. It has not achieved any significant reform at the WTO level. It has not achieved any significant reform in terms of trade rules beyond TRIPS or TRIPS in TRIPS Plus, and so on. But the impact is profound for those 6 million people now who are on antiretrovirals. This is a picture of a man who has HIV/AIDS before. Are they coming up? They're not coming up. Oh, I've got all these great slides. You're not even seeing them. Well, that's a drag. There we go. Well, let me go. Shall I go back? There you go. There's Charlie Brown. See? Tale of Two Worlds. 40 years later, defining global health. There you go. Global health revolution. before antiretrovirals, 6 months later with antiretrovirals, the life-saving, literally life-saving and transforming medications. And not only in terms of the individual, but for the families and the communities of people who who've been able to get access to treatment. That has literally transformed nations and is continuing to do so. Now, the Millennium Development Goals have been amply reviewed this morning, so I won't go through them in any great detail, but I will just highlight the first point, which is that they really came out of the 2000 Millennium Declaration, which was extremely important. Targets and goals and targets, in fact, were set. In 2008, a whole list of, here's the list, a whole list of very specific indicators were developed and were promoted as essential to achieving the goals. The goals that dealt with health were really three: Millennium Development Goal number 4, 5, and 6. First focused on maternal health, second on child mortality, and the third on HIV, malaria, and other diseases. But everything changed in 2008. It was the international financial crisis. The entire world of global health suddenly was a radically different place. The international financial crisis is central to understanding where global health is going. If we think about global health historically and then in a contemporary, from a contemporary perspective, there's a certain elasticity to the concept of global health politically and internationally. And I think it really achieved its peak just prior to 2008. What we've seen since is a decrease, a radical decrease in funding, and this is all under the aegis of the age of austerity. We now see states that were significant donors reducing or stopping their support for overseas development assistance. We see a call, we see a call among major donors like the G8 to actually reduce the amount of spending that they are engaging, focused on global health. But at the same time, that $17 trillion of public money that was mobilized to bail out the banks and to engage in economic stimulus globally, $17 trillion. At the same time that that has happened, we've seen the age of austerity, or the so-called age of austerity, being imposed on states, which therefore means imposed on citizens. And citizens are now being de facto asked to, not being asked, they're being told to pay the debts of the bankers and to pay the debts of the international financial system in order to maintain that system. In parallel with that, the necessary regulation, the necessary institutional change that is required to stabilize that system hasn't yet been fully put in place. And we see now, this is the cover of The Economist from last week. We see this is the title: "True Progressivism: A New Form of Radical Centrist Politics is Needed to Tackle Inequity Without Hurting Economic Growth." So we have a new kind of formulation, if you will, of the nature of politics and the nature of the relationship between formal political structures and economics. Now, the global contextual issues of the day are in my mind, are very, very simple. We're 7 billion people now. We're adding 1 billion people every 13 years. We have more than 1 billion people who go to bed hungry every night. There's 3.8 billion people who live on less than $2 a day. The G8 UN global governance system of the 90s shifted at the beginning of the 21st century to literally the G1, the United States, and then with the international financial crisis, it shifted again to the G20, to in relationship to the G1, the United States, and the BRICS countries. The United Nations has really been, in some significant way, sidelined by that major shift in geopolitical power. The Rio process, I haven't heard anybody talk about the Rio process. The Rio process has also been, in essence, sidelined by this major shift in international geopolitical power. We've also seen today that the rich are getting richer and the poor are getting poorer. Thomas outlined it very well this morning. And we are in the midst of a food, a fuel, and a climate and a governance crisis. This is creating egregious inequity with decreased adaptability of communities and decreased resilience of communities. The Millennium Development Goals, in my view, really do, people like acronyms. I actually think the Millennium Development Goals represent LCDs, the lowest common denominator. That's what the normative standards really, that were reflected in the MDGs. That, in my view, is what they represented. And they also represented a techno, if you will, charity mindset, that somehow it's possible to achieve public policy through charity. Charity is not a substitute for effective public policy, and yet on an international level, that's what we have. So I think one of the key issues in terms of the politics of dealing with the future of the MDGs post-2015 is this issue. How do we actually formally institutionalize funding, appropriate funding, for whatever goals or targets are set? Now, we're at a point now in our human history where the risks of, that we face in terms of food, fuel, climate, and governance are well beyond anything that we've ever faced previously. We are in the age of what has been called the Anthropocene. So great and so vast is our impact on the ecosphere of our planet that we are literally changing the very nature of the planet. Only human beings have amassed the very power to change the nature of nature. Never before has such a power existed on the planet, and yet that is where we are. We've already passed 3 of 9 planetary tipping points, and we're well on the road to passing others. Our population growth is massive and increasing. We are adding 1 billion people to the planet every 13 years. It is virtually unsustainable in terms of how we are growing and using resources from the planet. The issue that I wanted to focus on, one of the issues I wanted to focus on, is climate change. Now, the Lancet, which is the leading medical journal in the world, has recognized climate change as the greatest threat to global health in the 21st century. And it recognizes as well that the disparities that exist now will only be magnified and worsen, and will have a disproportionate impact on low and middle income countries. I'm not going to go through the details of this, but I will just point it out. Between 1979 and today, the Arctic sea ice has shrunk by 40%. That is unbelievable in terms of impact. We have no idea of what the impact of what the cascade effects of that kind of enormous ecological change will have on our planetary biosphere. We have models, we have some sort of loose predictions, but the scientists who deal with this already recognize that their predictions are vastly inadequate relative to the scale of what's already happening in terms of climate change. We're seeing extreme weather events around the world. Water security is now an extremely important issue, and particularly for Africa. Darfur, people talk about crimes against humanity, war crimes, slow motion genocide, all of which is true, but why are people fighting? People are fighting over decreased access to less and less potable water and to less and less arable land. And that's because of desertification. And that is because of climate change. We're seeing new re-emerging and emerging infectious diseases. We're seeing already seeing migratory effects of climate change, and there are scholars who estimate that we could see up to 700 million climate migrants by 2030. Drought is, for obvious reasons, already a profound problem in the southern region of Africa and in the eastern region of the continent. We're seeing major impacts in terms of food security. By 2030, the International Panel on Climate Change predicts that we will see a decrease in crop yields between 20 and 50% on the continent of Africa alone. And exactly the same is predicted for certain regions of South America and for Asia. This is real, and this is happening now. This is not some future event. This is now, and it is going to get worse. So, there are other issues that accrue around climate change, and I won't go through them in any great detail, but they're here. So The point that I want to make here is that when we talk about global health and when we talk about new goals for the next 15 years, this requires practical action. It also requires that we frame this in terms of justice and that we frame this in terms of an ethical approach to practical action. Now, it also requires that we build on what has already taken place over the last few years. The Rio process, however marginalized in the formal political process, is a serious and significant process. One of the reports that led up to the Rio summit this past June was the UN Secretary's Global Sustainability Panel report, and called Resilient People, Resilient Planet. I strongly urge you to read it. I am not a UN endorser by definition. I mean, I believe very much in the United Nations, but I don't by definition, because it's a UN report, endorse it. This report is a profoundly important report. It is detailed, it's rigorous, and it is, in relative terms, relative to former UN documents, radical in terms of the kind of proposals that it puts forward. The issues that are being discussed here in this group are very nicely framed in a moral, ethical, and economic and political framework in this report. And I strongly urge the group to pay due attention to it. One of the things that it focuses on is a fundamental reorientation and restructuring of national and international institutions. The kind of issues that Thomas raised earlier this morning would fit perfectly into this framing. One of the issues that I think is also extremely important is to, as I said, is to build on prior initiatives. The currency transaction tax, or the Tobin tax as it was formerly known, is a very powerful idea. It's known as the Robin Hood tax by some. For those who are unfamiliar, it's basically a small percentage tax on international currency transactions. And if taxed at a rate of 0.005%, would generate $40 billion a year in revenues, which could go into the Health Development Fund. If taxed at 0.05%, it would generate $650 billion a year. And it would also curb non-productive speculation. Global health as well is core to the Millennium Development Goals, and particularly is core to the climate change talks, which are ongoing. And yet global health has been totally marginalized from climate change talks. They have not been at the table, and nor have their efforts to get to the table been met with any kind of warmth or reception. In fact, they've been actively excluded. Now, in my view, this is my last couple of slides, achieving greater equity in global health, it really does require innovation. It requires a different way of thinking about the problem. If we don't think differently, if we don't think beyond the techno-charity mindset, then all we're going to do is just magnify existing inequities. We need to be ethically explicit. And I think an idea of a global health, a global ethical framework is not something that should be dismissed. The preamble of the Millennium Declaration, in fact, is a very good example of a set of clear ethical imperatives and clear ethically motivated political imperatives that motivate the technical dimensions of the subsequent declaration and the subsequent Millennium Development Goals. I think it's important now to start thinking about a secular ethics. Is it possible to develop a global secular ethical framework within which a political economic project, which is by definition a Millennium Development Goal project, within which that project could take place? I'm not sure what that would look like, but I would like to put it into the dialogue. That framework would have to include, as partners, as speakers or partners or actors, governments, the private sector, civil society, and the spiritual community. If we ignore the spiritual community, we do so at our peril. The spiritual community is a very, very powerful force around the world. And it can be engaged to actually augment and actually give clarity to some of the political and economic issues that we are talking about here. The final slide is really an appeal to the two prior speakers, an appeal to you to endorse what the two prior speakers have been saying. The importance of framing, the importance of how you present ideas. It really, really matters. George Lakoff, who's a linguist and a neuroscientist, has developed a theoretical base for understanding how we as human beings understand ideas. And he basically argues many, many different things. But what I want to highlight today is that the idea that we use real reason, logic, to assess to assess data or information or evidence on which we then make our choices, this is just not the way we actually work as human beings. We are not logical beings. Logic and reason is one part of the toolkit that we use as human beings to actually make decisions. He argues that, in fact, most of our decision-making, and he has very good evidence for this, neuropsychiatric imaging based on positron emission tomography and dendritic analyses and so on. Very, very good evidence for this. He argues that most of our reasoning or our decision-making is subconscious, is apparently illogical, but within each loop, there is a logic. But if you compare one loop to another or one system of thought to another, they are inconsistent and illogical. But it's the frame, it's the total package of ideas, the meaning, as he calls it, that we use to make decisions around any one piece of evidence. We take evidence and we try to fit it into our existing frame, and that is largely a subconscious process. Now, this is well studied, and it's really well worth understanding in terms of messaging, in terms of ideas, and in terms of communication. And then other issues. Values and beliefs are key. They can be key to motivating people and to framing, again, ideas, numbers, political objectives, and so on. And I think that the last 2 points, giving people a positive future, a sense of possibility, a sense of a viable tomorrow. This is fundamental. If you scare the hell out of people, what happens is people freeze. They stop thinking, they stop engaging, and they start closing off, coveting, protecting themselves psychologically, physically, economically, and so on. It's extremely important that framing is done in a way that actually invites people into a positive world of possibility, that we can actually achieve something meaningful together, and that it is possible there is a future. It's not going to collapse, well, it may collapse, but there is a future even beyond that, and it depends on how we approach it. And then the final point is that active problem solving, engaging people in in the challenge of solving problems and avoiding the kind of false deification of the expert. This is really quite important. People are not stupid, and it's not. It is a mistake to think that only the experts know, and that the experts will somehow figure it out and then hand the 11th commandment to the masses, and that they will suddenly say, "Oh, thank you," and get on with the great new project. People are not stupid. I had the privilege a few years ago of speaking on a panel with Noam Chomsky, and one of the questions from the audience came from a professor, a very scholarly and well-known professor, who basically argued, well, that's all well and good on the issues that we were describing. That's all well and good, but the masses just won't understand. We have to simplify it for the average person. Now, I stood there on the dais with Professor Chomsky, and I watched him turn red, and I watched his carotids swelling with raised blood pressure, and I watched little beads of sweat form on his head, or on his forehead, as he tried to contain his anger. And what he said was, you know, Americans pick up the newspaper every single day, or they go to the website every single day. And the very first thing they do is they turn right to the sports page. And then the next thing they do is they figure out earned run averages, batting averages, home run hits, and they figure out the position of their particular team in this very complex system of game, whatever you want to call it, of game theory or whatever, I don't know what it is. But this very, very complex mathematical system. People can figure this out, right? So, and you don't need to have a PhD in statistics to be able to read and understand and then to make intelligent choices based on the sports page. And if you can do that, you can understand basic economics and you can understand basic social policy. And that was essentially his argument, and I've used it ever since. And I think it's quite important that we think in those terms. People are not stupid. The final point, leadership in today's world, in this context, is not about formal institutional structures. Formal institutional structures are extremely important. They have a formal legitimacy, and that legitimacy must be respected, and it also must be enhanced. So we must build and increase the credibility of the UN system, for example. I believe that if the UN system didn't exist, we'd have to invent it. You've heard that many times, but you've heard it again, and I still ask you to really think about it. We need the United Nations. For all of its warts and for all of its problems, we need it, and we can fix it. But at the same time, the system of governance that has emerged, particularly in the last 25 years, is a fluid system. We do have new actors. Civil society organizations are extremely important. Labor movement, extremely important, transnationally. Foundations, in terms of health especially, extremely important. Formal governance systems, extremely important. The private sector, extremely important. And, of course, as I mentioned earlier, the spiritual community, extremely important. Distributive leadership is not looking for the Messiah. Distributive leadership is about looking for and supporting different types of leaders, both formal and informal, and mobilizing that around a particular set of objectives. And I think that really is the challenge for this academic community, is to understand how that process works, to articulate that process, and then to support those who are actually going to be implementing this process or trying to implement this process over the next 5 years as we both formulate the objectives and then hopefully implement them. Thank you very much.
I want to start by dedicating whatever I'm going to say to a man who exemplifies what I'm talking about, someone for whom the relationship between a human rights framework and the development agenda, the economic and financial mechanisms that drive the world political economy, and the ethical framework and legal framework that motivates all human rights work is Arjun Sengupta, former ambassador of his country, India, former advisor to the Prime Minister, former chair of the National Commission on the informal sector, and from our point of view, former independent expert on the right to development at the United Nations, independent expert on extreme poverty and human rights, and until his death, his untimely death just two years ago, the chair of the working group consisting of all member states of the United Nations on the right to development. And he was a dear friend and a close colleague and somebody who exemplifies what we're aiming to do here, is to think clearly of the ways in which an ethical framework for alleviating world poverty can be, can mold global thinking on the next step in the Millennium Development Goals. He and his wife, Jayashree, also happen to be the parents of Mitu, who has been magnificently organizing this event. So the question that I want to address is the extent to which economics and human rights are radically different. Do they reflect different mindsets? I think Gilad asked us to reflect on this also. Different ways of thinking. Can we marry ways of thinking? He was suggesting marrying the ways of thinking of the that's right, MDGs and the SDGs and how they were different. What I'm going to suggest is, can we find ways to productively draw upon the principal thinking of economists and the principal thinking of work and human rights. Now, the starting point, of course, is to say they are different. Their tools are different. Their training is different. One is focusing on utility as a self-assured well-being. The other is focusing to draw upon the words of the Universal Declaration of Human Rights, assuring the dignity and worth of the human person. Priorities of economists have been constantly referred to as here as focusing, perhaps excessively many would say, on growth. But they will never depart from growth, because growth is essential to what's going on. What kind of growth is the issue, and that's what has been discussed here. Efficiency, resource constraints and trade-offs, infrastructure issues, equity issues, governance issues, measurement issues. This is the bread and butter of what economists do. This is not the bread and butter necessarily of what people do in the human rights field. Can we therefore expect an economist-driven agenda, such as the MDGs, to productively respond to those who are clamoring for greater attention to human rights in the MDGs with very limited success and in the next step? There are several terms that are frequent in human rights work that sometimes economists are not aware of, and Arjun became very acutely aware of, is that within the human rights framework, the right to an adequate standard of living occupies an important part in all the rights relating to the right to an adequate standard of living. The concept of progressive realization, the concept of a core minimum, knowing there's some things you can do now, other things that are going to have to wait. The rule of law and accountability, which are also terms that are quite acceptable in international financial terms. The principal standard that should appeal to economists who look with suspicion on a human rights framework, saying you are people who want everything now, you don't understand the real world. We operate in the real world, which is a world of resource constraints. Well, the fact of the matter is, in human rights formulations from early on, the acknowledgement that human rights, especially those relating to the right to an adequate standard of living and all related economic, social, and cultural rights, are subjected to the principle of available resources and progressive realization. This is fundamental to the human rights framework and the first step in creating a productive dialogue. A second step in creating a productive dialogue between human rights and economic thinking of development, which would be essential for introducing human rights into the next step of the MDGs, is to draw upon the productive framework that was frequently referred to here of human development and the relationship between human rights and human development. And the issues of the Human Development Report that you see here are simply to remind you that in Sekiko's time, she had the wisdom of devoting an entire issue of the Human Development Report to human rights. And from the very beginning, as you can see from this quotation from the Human Development Report of 2010, human rights occupies a place. The sort of fundamental thinking, drawing again upon Amartya Sen, who was alluded to in a previous session, is that human rights and development shares a common vision with human rights. The goal is freedom. Human development and human rights are mutually reinforcing, helping to secure the well-being and dignity of all people, etc. Now, this is nice in the context of human development. Will it work in the context of rethinking the Millennium Development Goals? Well, in the context of rethinking the development goals in preparation for the summit of 2010, there were human rights NGOs that one normally doesn't associate with an agenda such as this that clamored very strongly for greater attention to be paid to human rights. This is a demonstration by Amnesty International, one of the slogans of which was "Maternal health is a human right," seeking to introduce human rights thinking into the formulation of the MDGs. Now let me make an aside here. Varun was referring to the legal framework and the fact that he was suggesting that we think about whether the next phase, what will replace the MDGs, could draw upon the role that law plays in human rights frameworks and human rights action. If this were to be done, the thought occurred to me, it would suggest that you would need a legal framework that could pull together the wider range of issues addressed in the Millennium Development Goals and in the subsequent approach to sustainable development or whatever framework, inclusive development, whatever framework is taken. There's another process going on in which Arjun Sengupta played a key role, which is the right to development. And the right to development is at a stalemate now because of a confrontation precisely over the legalization of this human right that is all embracing of the issues that would be covered in the Millennium Development Goals. It has been a position of the non-aligned movement representing about 130 countries that this process must result in an international convention. This quotation from the NAM summit, the heads of state of the NAM countries have said that the process of the United Nations machinery must result in the elaboration of a convention. Western countries have said, this is where we draw the line. We will go along to a certain extent with right to development concepts. Where we will draw the line is if you push too hard on this. Canada, for example, said in polite diplomatic language that Canada does not believe it is appropriate for the working group or the high-level task force to consider the development of a legally binding instrument on the right to development. What that means is, if you mention it, we vote no. And typically, when it is mentioned, depending upon how explicit the mention is, you end up with up to 40 or 50 negative votes on the resolution. Now, so let me leave that aside for a minute and come back to it at the end. The principal point that I want to make is that in the history of the MDGs, there have been efforts, beginning with the High Commissioner's immediately launching after the MDGs were launched, a table showing each of the MDGs and the equivalent obligations of human rights treaties. That's a starting point to remind governments, you've accepted these MDGs, wake up, you also have legal obligations on precisely those same issues. And here is what they are and here's where they're located. That was not quite enough, and the Secretariat made several other efforts, including commissioning from Malcolm Langford a document that much more exhaustively goes into the human rights dimensions of the MDGs that was published in this book called Claiming the Millennium Development Goals. I'm short on time and I'm not getting, well, this is 1 minute long. I'll play this one and not the other one. I've got another one. Okay.
I felt really from the beginning of the MDGs, and I was in the UN at the time, that it needed more of a human rights approach. That we weren't going to achieve the halving poverty, every child having access to education, unless we understood that there are these human rights barriers, discrimination, minority status, vulnerability, being a young indigenous woman, all of these things, and somehow we didn't want to grapple enough with that. So yes, we will make more progress if we take a human rights approach. Can I just illustrate by one of the MDGs that's not improving? Maternal health, maternal mortality. In Sierra Leone, to become pregnant means you have a 1 in 8 chance of dying. That is horrific. In my country, Ireland, if a mother dies giving birth, the maternity hospital mourns, the community mourns. It shouldn't happen. A 1 in 8 chance, that is to me a gross, gross unfairness. We need to help Sierra Leone, which is acting very strongly on access freely to maternal and child health. And good luck to them. It's a government that's absolutely committed. They need to realize it's not just a health issue. It's also a poverty issue. It's a nutrition issue. It's an early child marriage issue. It's a discrimination on access to land, access to property rights generally. It's the young girl in the family and how she grows up to be a mature woman who can safely have children. And there are a whole range of human rights issues. And we will not make sufficient progress unless we have that holistic approach.
a bit more eloquent than I am, so I thought I would give you that to make the case. This we don't have time for, but this is an excellent statement that came after the summit, which did, in response to efforts that were made by the High Commissioner at the time, Ali Yemen, Mary Robinson on her own, and so on, to introduce human rights concerns into the summit document of November 2010. Approximately 13 references to human rights were made in there. Subsequently, a number of studies have been made by Sakiko Fukuda Parr and a variety of other people, Ali Yamin, on what should be done to introduce human rights more systematically into the next stage. And Mark Darrow, in this publication called Human Development Goals, Milestones or Millstones, Human Rights Priorities for the Post-2015 Development Agenda, I think quite thoroughly analyzed the background and challenges that are to be faced here. As has been mentioned here, the Secretary General has proposed to move from MDGs to SDGs. The question is, if the marrying of the various agendas on post-2015 takes place, will it be to the detriment of appropriate attention to human rights, or is it an opportunity for appropriate attention to be made to human rights? Certainly the current High Commissioner, in the run-up to Rio +20, said that states must resolve to work to advance the human rights-based approach to the green economy, which is the watchword of the Rio +20, and she referred to working for a model of economic growth that is socially and environmentally sustainable, just and equitable, and respectful of human rights. The development agenda to which I referred yesterday is a compilation of the various development objectives that have been defined and agreed to by member states throughout, especially the decade of summits of the 90s, and to which should be added summits that have taken place since the Millennium Declaration, within which there is a wide range of broader approaches to achieving global justice than those contained in the limited 8 objectives of the MDGs. In the outcome to the Rio +20 summit, there were a number of references, thanks, I think, in large part to the efforts by the Office of the High Commissioner for Human Rights to introduce a human rights perspective into the summit outcome document called The Future We Want, in which they said the governments affirmed that green economy policies in the context of sustainable development and poverty reduction should promote sustained and inclusive economic growth and respect for all human rights. So the efforts made to deal with the human rights blindness of the previous MDGs has led to a considerable amount of thinking and a modest amount of progress. The question that I'm putting before this assembly now is, in rethinking what is going to take place in the coming few months, as Gilad has constantly reminded us, we're not talking about a 3-year window, we're talking about a window of a few months. Can we draw upon these efforts by Mac Darrow and Sakiko Fukuda Parr and Ali Yemen and all the others who have, and the High Commissioner herself and the previous High Commissioner, Mary Robinson, have put so much effort into utilizing a human rights framework to demonstrate the mutually reinforcing character of these two United Nations agenda, the development agenda and the human rights agenda? Will we be able to draw on that to do it in a constructive way that will make the definition of the development agenda post-2015 a superior document coming close to the objective? And I'm going to conclude by acknowledging, as others have, the pioneering work of Thomas Pogge to take the ethical responsibilities of the injustice of the global economy and to realize that it is not a matter of preachiness, it is a matter of right. And that is the principal reason why a human rights framework strengthens the ethical agenda of trying to achieve global justice post-2015. Thank you.
And Gilad, actually for this, Gilad asked me to put together something that were more my views on the conversations we've had, something that I've written. So this is more perhaps a summary of what has been said yesterday, and I hope something new. But I wouldn't be too disappointed if it isn't something new really, because we are trying to gain consensus here. So I think it's okay. These pictures I've put here quite deliberately, and the pictures I've put here, the first two pictures is a bit that I talk about. That's the growth. That graph on top is the growth chart for China at some point between in recent years, shooting up. That's all the goods being transferred for your Christmas presents, shipping from China. The other two pictures, that are the three pictures there, these are the grassroots good practice models, something like something like what Ananya Mukherjee Reid talked about yesterday. So this is really the grassroots self-help groups also that I have studied in rural India. And the other picture then again is what's leading that, what is behind that, or what's causing that graph is causing that that industrial process. But then we can, of course, say, no, we can continue with that graph and just have clean energy. And I've got a bit to say, is that the solution then? We just switch from fossil fuel to biofuels and we'll be fine. Our cars can run, 5 cars per family can run on biofuels, we'll still be fine. So I've got a little bit of that in the presentation. Then we've been talking, Thomas has been presenting on the different poverty lines and how we calculate, how we measure poverty. That woman definitely lives around, I would say, over the $1 a day, or even $1.25 a day. But is that what we are aiming for? She certainly has a livelihood. The picture on the right extreme on top. So she's got access to some sort of water. So is that what we are aiming for beyond $1 a day poverty? She would be counted as not being poor. Then the picture on the just picture below there, that's a very interesting picture. And I can, if I was to ask the audience a wild guess what that picture would be, I doubt if anybody would be able to say. This is a picture of the riots from London from last summer. So all these pictures, they do come up in the presentation at some point or the other. So, okay. I'm just going to, this 15 minutes, I will try and just use making 3 points. First, I thought, because I'm presenting some conceptualizations of drivers and some insights, so before I get to that, a very quick recap of the emerging agreements and disagreements. And I'm quite sure there would be disagreements on the agreements I present, and there would be, and the other way around, but that's fine. We are all trying to debate and move forward. Then I'll present a conceptual model and the possible drivers for the new post-2015. We can have presented 3 drivers and we can work out scenarios taking the same dimensions of poverty. In the beginning, Gilad said my research uses the capability approach construct, by which I take poverty as multidimensional. So I've used different dimensions to see what the scenario would look like if we use any one of those drivers for the development agenda. And then just some insights, views again on seeking a consensus. So just a quick recap. I think all of us in some form or the other would agree that there are contrasting contexts in which MDG 1 were born and in which the MDG 2, the post-2015 agenda, is going to emerge. And I have some data in the next slide. The first, what I call from financial buoyancy to financial slump, and we can just look at some data. The second point is that data on climate change is now far better integrated into development research than was done in the first set of MDGs. The Brundtland's report, 1987 and 1985, and then the 1992 Rio, these discourses, what emerged from there was far away. It was just quite a disconnect between the development discourses that emerged after that. But clearly in this now, what we are looking at, there's very close integration between the two. I tried to just Google and find how many university departments or courses have come up with doing climate change and development, and in what span, let's say beginning from 2000 and now. I couldn't sort of find an exact number, but in 2000 there were just, I could look at the number, huge number that comes up in the current, and if you go back you find this is really, really very a small number. I couldn't give you an exact number right now, but yes, so this is something positive. And then the third point is the changing landscape of poverty. Joseph Wong yesterday talked something about, and he did say this data has come from the UK. I will provide you the source of that data, the research that says there's more number of people, poor people living in middle income countries, and where that is coming from. And there's a slide for that. But I would like to talk about the point after that, which is the blurring of boundaries in the understanding of poverty in the North and South. I think there was a lot of points being raised yesterday and also, or today also, but mostly yesterday, a very strong points from both sides, and that poverty just being located in the South. Now that has clearly changed. I have given examples of the what I call the social rupture in 2005 in Paris and 2011 in London. There have been various reports, extensive research, and this is clearly, these are dimensions of poverty that exist in pockets of inner cities. I can give a very clear European picture, and I'm sure in North America with Hurricane Katrina, it was quite well exposed what was happening. So poverty is certainly not somewhere in the southern context now. Yes, the dimensions can be different, the expressions would be different, but what the outcomes would be similar. So you do have, that is a very clear emerging discourse now. And there's very good literature also. And then leading on to that, another point is the rising global economic and social inequities. Somebody else yesterday mentioned Kate Pickett's book, and that focuses on in a really very clear way in the inequities in the North. There's also research by Frances Stewart and her group in talking about horizontal inequalities. This is all to do with inequalities in the northern contexts. And there's also research by Durkheim and Shapiro. So this is all emerging research coming to support providing this evidence. And then I make another point. So there's also emerging evidence and agreement on the global interconnected problems. I think quite a few people have talked about that, so I won't go into too much of detail. James also talked about, excellent slides on that, so I won't go. So financial buoyancy, just to give you some quick data. In 2000, the high-income countries were projected with 3.2 to 3.5 in that period, and developed growth. And this is developing countries were projected, this is a band 3.1 to 6.1%. This data is from the Global Economic Prospects. In 2012, growth forecast for HICs is 1.4, -3 for the Eurozone. Developing countries is 5.4. Of course, we can disaggregate and you get different numbers, but this is just an illustration of how the contexts are different. Global trade volume in 2004 was 10.2% percentage change over previous year. In 2009, it is -10.4 over the previous year. And then global interconnected problems, I think there was a whole presentation on food insecurity yesterday. And you see that food insecurity is just not a southern problem. And the interconnectedness through biofuels, which is connected with our lifestyles, climatic volatilities, and speculation and demand. So you can see many of these causes, etc., are located both north and south. So that it isn't now them and us, it is all of us, or we are all doomed. Okay, so I have again that I was talking about that data, that research that middle-income countries now are home to the more poor than low-income countries. And the two tables here, what they show is that if you see the first table, that will show upper and middle-income countries are growing quite well. So growth, economic growth is quite very robust, has been during the economic slump as well. But in terms of the number of poor, these are the low and middle income countries. You can see the number has just expanded. 70% in 2012 of the poor live in these countries. So clearly growth is not translating into lifting people out of poverty. So growth cannot alone be the remedy for poverty reduction. So there has to be something more. There's very clear evidence, whichever way you look at the data, that data is strong and it's there. So the disagreements. Those were the emerging agreements, and I'm sure many of you could disagree with that. So the disagreements are here, that how you implement global finance regulation, or whether you implement it at all. Those of you who might remember some time back, it was last year, that in Europe there was a very good, we really came very close to implementing financial regulation mechanisms, except that Mr. Cameron actually walked out. As you know, Britain is the it is a tertiary-led economy now. The secondary in the manufacturing sector was done away with. So if they impose such financial regulatory mechanisms, the fear was that the banks would just go away. The banking sector would collapse, the financial banking sector. So he vetoed that, and then Europe couldn't agree on that. So there is a huge disagreement there. Trade is asymmetries. All of us agreed there are asymmetrical rules, and both Thomas and James gave a list of the different areas where there are asymmetries, but we still don't know how to implement. We can't agree on that. Aid and its relevance, this is becoming more and more contentious. Yesterday, some provocative remarks made and evidence provided, etc., on whether aid is done any good at all. But we still need money. I mean, we are talking about Tobin tax, and most of us would agree with something. Divert that money for this purpose. So whether it is coming in the form of ODA or whatever, you need resources, so that we don't need aid. Mustn't be mistaken for you don't need resources for poverty reduction. So that's again an area of contention. Implementing green growth and green agenda, that's an area of disagreement. We still don't know how to do it, or whether it should be a top-down, bottom-up, we don't know. Carbon footprint and lifestyle, we talk about it, but if there was a survey done, how many in conferences, how many of you have taken the shuttle and come here? How many are going to take cab? And how many of you are using plastic? Excellent, thank you, Gilad. So, we are all, these are lifestyle changes, but we don't know. And also whether we need more private goods or public goods. We would agree that we need more public goods, but nobody knows how to implement, how to do, how to use it, etc. So here's my conceptual model. Based on my agreements and disagreements, I have chosen 3 drivers. We have the environmental driver. If suppose the agenda was to have the environmental driver, and then my 4 key dimensions of nutrition, health, education, public goods, which I say in the post-2015, these are core areas, and they would remain. If environment was your driver, then the focus would be on local food production, ecologically grown food, and changes in lifestyles. And some of it was yesterday also, we talked about looking at, I think it was Professor Berry talking about encouragement to small firms, looking really local, and there was another presentation looking at local agenda, contextualizing, so that would be the one. In terms of health, we wouldn't be looking at the big picture. You have to address the local needs. And in fact, the Health Impact Fund that Thomas talked about setting up, I think those issues would be very important. In terms of the education, emphasis is right from the beginning. So you made aware that knowledge comes right from the beginning of these issues. In terms of public goods, Elena Ostrom's Commons approach would certainly play a big role in how we approach access to private goods. And in all this, there would be concerns of concerns for inequity in all of them. If we take social as our driver is social agenda, you'd find that these dimensions are still they are quite different to the last one, which is the economic one, and which is what we've been following. And you can see access to public goods is free market. This is the neoliberal agenda. Now it's for us. This is for academics to agree. This is an opportunity. We've been following the economic one. We are here. The free market, the neoliberal proponents would say, well, this is how the free market equalizes itself. It was coming to a tipping point. It collapsed, and it will come back again. But is that what we want? So we have to ask ourselves, which driver are we wanting to go? And this is how my proposal is, that sustainable development agenda becomes the overarching framework. And then we can frame, it can be framed in the sustainability terms. I'm not suggesting rigid, in any rigid way. And core areas of poverty, health and nutrition, education remain. Addressing global inequities. Again, see, global inequities, it doesn't mean it is just north-south. There are inequities north-south. There are huge rising inequities south-south. So all dimensions of inequities have to be addressed. And so that is a new goal. Addressing inequities becomes a new goal. Global financial regulation is critical. If we don't do it now, we might have to wait for another one. That is when we recover from this one. Global goals and local agenda. So my emphasis is on really the local context. And this was one of the problems that wasn't included in the MDGs. There were global goals that we decided to implement it at the local level, and then all sorts of at the country level problems arose. So in this time, it should be made very clear. While these are global goals, but here is the local context. So I have given an example of inequality is a global goal, but within the context of UK, addressing deprivation and ethnic group-based inequalities would be the problem or the context in UK. Whereas if you take India, that would translate into addressing deprivation and caste-based inequalities. And my last point here is keeping it simple. So again, what Varun talked about, the narrative. I'm not, by keeping it simple, it doesn't mean just taking up on James's point that people are stupid. No, people are, I think, extremely intelligent. But as academics, we need to make an effort. So the onus is on us to communicate to them in a way that both this is a dialogue and it is not a monologue. So we really are looking for framing questions, framing the values so that it's an engaging process and it is not a donor-recipient relationship again. So, and the narrative that Varun talked about, so using the language that both of us talk. Thank you.
Just continuing, before I open it up to audience questions, continuing exactly from where you stopped, Stephen, I think the issue of human rights and how they really enter into a post-2015 agenda is probably a question that interests all of our panelists and everyone here. And I have a report and a concern. So the report is that every document that I read from the UN, at least from the UNDP, has human rights every second sentence. And when I forget, when I write a report for Beyond 2015 and I forget to write human rights because I'm talking about something else, they remind me, don't forget to talk about human rights. And this is my fear, and this is a question to all of the panel, because I think you know what the question is going to be. How do we avoid using the language of human rights merely aspirationally as a beautiful preamble, and then having none of the real teeth and accountability that comes with it in the actual framework? How do we avoid a situation where human rights is something to hide the fact that the substance of human rights is actually not in the agenda? You need a microphone, I guess. This is for whoever wants to take a question.
That's for me.
Or anyone who wants to take. I think it's a question that...
Well, obviously that's going from zero attention to human rights in the formulation of the MDGs to the situation where you feel they're being dropped in excessively is an unfortunate evolution, but I don't think that's quite the situation. It took, if you look at document 0 of Rio Plus 20, there was also zero reference to human rights. It took a considerable amount of lobbying by the NGOs there and the representatives of the Office of the High Commissioner for Human Rights to get in the few references that we had, and I only showed one of them, but that was only one of a half a dozen that were in there. So it's not always the case that human rights are superficially peppered over a document. What I think is the challenge for the drafting exercise in which you're engaged is to utilize a human rights framework in a way that genuinely is relevant to the processes of moving the development agenda forward, of emphasizing the ways in which, the very concrete ways in which compliance with legally accepted obligations overlap with commitments to resource allocation and policy changes. Now, those resource allocation and policy changes decisions can be made on vague references to development agendas, but they can also be made on the basis of specific legal obligations in the human rights framework. And that's what the High Commissioners have attempted to do in the past. That's what people like Mac Darrow has attempted to do in his major article in that Yale journal that I was referring to. And that's what I think should be done by those who participate in the processes that you're engaged with. I'm sure others have things to say about this as well.
So it's pretty easy to use human rights as window dressing, because it's very attractive. It's a very attractive window dressing, and that's the concern. What comes to mind are a few ways in which one could try and make it more than that. One is to include it in the causal story. As Mary Robinson said in that clip that Steve put up there, that discrimination itself is a pathway through which we don't achieve MDGs, or lack of understanding of equal dignity. So that would be included in the MDGs itself, or as part of the story for why we aren't achieving the health and education and poverty outcomes we want. Another way would be to create a kind of quasi-juridical monitoring mechanism, so that there are entities that can make claims, petition to bodies to see that the MDGs have not been achieved. And a third might be to assign monitoring of the MDGs to human rights agencies, so that they themselves would be responsible for overseeing the two and would have similar outlook.
I think when we talk about human rights in MDGs, we should unpack this thing called human rights. I mean, human rights means all kinds of things to different people here. And I think that you can think of human rights as this kind of a long list of items that are in the international covenants and other treaties. But if we can focus on certain specific characteristics of human rights as applied to development, I think it makes it easier. It sort of gets away from just bandying around this term human rights And so the principles of participation, transparency, accountability, and equality are the ones that, in a sense, are what should be focusing on. So, I mean, instead of saying, let's stick in human rights, I think we should think about, how do we bring in participation? How do we bring in transparency? How do we bring in equality? And then I think that I personally find it difficult to sort of systematically put all of these things in a balanced way or a comprehensive way in every aspect of what we might do with goal setting. But I do want to say once again that for me, that I think equality is something. Equality in rights, non-discrimination. This is perhaps the principle that is most amenable to being integrated in the most effective and powerful way into some set of goals. And that's why I do feel that recognizing reducing inequality as a global goal, as an important social priority, is actually important. And I also think that it's very strategically important. In the current debates about post-2015 and also about the SDGs that are going on around the world and also in the UN, I think that there is a clear recognition that the neglect of inequality has been a major problem. So most of the debates recognize that one of the major flaws of the MDGs was that they did not include enough attention to MDGs. The only inequality goal is one that's related to gender inequality, and I think there are 3 out of 60 indicators that somehow relate to inequality. And currently the literature on economics is increasing. Development economics literature is increasingly recognizing inequality as an obstacle to economic growth. Therefore, the instrumental value of reducing inequality for economic growth and other kinds of social progress. And Stiglitz, for example, has written his book called The Price of Inequality, the price of inequality, right? And in many Latin American countries, they have adopted inequality reduction as an important objective. Dilma Rousseff in Brazil talks about it a lot. And they have actually started implementing economic policies that have been successful in doing this. And academic economists have started investigating how inequality has been a constraint to economic growth in Latin America. So, I mean, the idea that inequality is an inevitable outcome of economic growth is being increasingly, once again being challenged in a fairly convincing way. So I think there is a case to be made for this. And what I find quite astonishing is how much political resistance there is to accepting reducing inequality, or even using the word inequality in something like the global goals. And there is a lot of political resistance amongst governments because they think that their presidents or prime ministers think that this is some sort of an open invitation to redistribution and redistribution of taxation and all these policies that politically it was not part of their agenda domestically. So I think there's going to be a real fight about inequality as a goal in itself for the next 2 years. And I think that for a group like this one, it's really important to decide what to do about it, whether to really line up against that. Just strategically, I think this is going to be a big issue.
I'd like to give the panelists the right for first question if you want to ask something of your co-panelists. So let's open it up to the audience. Actually, let me acknowledge one guest. So just echoing what James said about what did you said, that if we don't engage with the spiritual community, we do so at our own risk. So in that spirit, I want to acknowledge the Reverend Dr. Karen A. Hamilton from the Canadian Council of Churches, who's asked to say some words to us. And I'd like to invite you maybe to say something about how can the spiritual communities engage with processes like the post-MDGs.
All right, 2 minutes. I want to thank everybody who's here, and I want to thank the panel, and I want to particularly thank James Orbinski, because you set me up so perfectly for the 2 minutes that I now have by talking about the importance of engaging with the spiritual community. You just heard me introduced as the General Secretary for the Canadian Council of Churches. That's completely true. 24 denominations representing more than 85% of the Christians in the country. We also work with the Evangelical Fellowship of Canada, which represents another 20%. I know you're doing the math, there's an overlap. But I also work very closely with the National Jewish community, the National Muslim community, the National Hindu community, Sikh community, First Nations, Buddhist, Baha'i, so that when I go, we just met today, when I go to London Friday for November 2nd for the UN High Panel, I go as the only spiritual leader on the group of 20 for November the 2nd, and I go carrying the thoughts and the wisdom of all of Canada's faith traditions. I say that with a lot of trepidation and humility, and my Jewish colleague yesterday said, no, go, speak on our behalf. You can speak on behalf of all the traditions. But I think it is really, really important, James, what you said, because we're trying to build community and network and relationship. Although in Canada we don't always believe and understand this, the vast majority of the world's people are people of faith, and they derive their primary identity through their faith tradition. We all know the complexities of that, and we all know the ways that that can prove problematic. Whether you agree with it or whether you don't, the point is the vast majority of the world's people see themselves as people of faith. And when you're talking about MDGs, pro, con, however you want to talk about them, how people's physical needs are met is by the concrete realities on the ground. And in so many cases, that's done through the faith traditions. Who delivers most of the bed nets to help combat malaria globally? In most cases, not all, but in most cases, it's the faith community. So you need to be engaging that. And let me tell you just one more quick thing. Images are all over in terms of what's said. It's really engaging to listen to people and then be able to pick up their images. So I just want to talk a little bit about images in the 15 seconds left to me. We heard about the MDGs as glass half empty, glass half full. We heard that kind of language. Why don't we fill the glass? Is the issue that the glass is half empty or the glass is half full, or that the glass needs to be filled to the top? Think about that. 2005 was also mentioned earlier this morning, in fact. One of the things that some of you might not know is that 2005 was the beginning year of the Interfaith Leaders Summit. Since 2005, all of the faith leaders of the world's traditions have been gathering in whichever country is hosting the G8 or the G20 in a parallel summit to challenge the G8 or the G20 to particularly focus on the Millennium Development Goals, and consensus has been achieved in terms of the statements that are produced. Conversations are happening with government, with the Canadian Sherpas, with the G8 offices all around the world, with the prime ministers. All of these things are happening through the spiritual communities. And I'm going to finish with the importance of image again. And I know there's been a lot of discussion about that and controversy. I know this is an academic event, but we've got to get out and network and build relationships and engage in community. You heard the figure that only 5% of Americans, I'm sure it's a similar figure for Canadians, have even heard of the MDGs. Whatever happens in the next 3 years, and let's push around development the next 3 years. Whatever happens after 2015, maybe we could do a little better than that. And here's the kind of image that works. When I'm called upon to preach on, in my tradition we say the gospel, but talking about the MDGs and the imperative for life for all people, I'll use this very graphic statistic. Every 45 seconds, a child dies unnecessarily of malaria. You hear Bono do that kind of thing. It's, you know, it's fairly common. It's out there. I'll say that, and then at the end of the 20-minute sermon, I'll have done the math for them, or the 21-minute sermon, or the 15-minute sermon, and tell them, using that kind of simplistic image, how many children have died in the course of the sermon. It helps people concretize and be inspired. And surely, however we think through the technical aspects of this, it's about community, it's about healing, it's about fewer people dying.
Thank you very much. Now I'd like to open it up to audience questions. I think, Melissa, you were first with your hand up.
Thanks a lot. Thanks a lot to all the panelists. Very rich set of ideas you've put forward to us. And I want to come back to this question of framing, of rhetoric, of imagery. And I think there have been two candidates that have been put forward by this panel as the leading conceptual frame through which to express the revised MDGs or SDGs. And they are combating excessive inequality, so the equality frame and the human rights frame. And I think, as Sakiko suggested, part of the appeal of the human rights frame is precisely that human rights are, by definition, rights that all human beings should enjoy equally. And so there is a deep connection between the equality frame and the human rights frame. We've also heard about how politically how much it's an uphill battle politically these days to use the rhetoric of equality, particularly in the United States now. I was just at a conference a couple weeks ago where someone was talking about the corruption of the political process there by the excessive influence of money, and how one cannot contest that phenomenon using the language of equality, even in making presentations to the Supreme Court of the United States. Equality is a rhetoric that's not available right now politically. So that suggests that perhaps, just for purely rhetorical purposes, we know that a commitment to equality of some sort, or a reduction of the extremes of inequality that have developed in the last decade and a half, 2 decades, and a concern for human rights are deeply, deeply connected. But perhaps the human rights frame might be more rhetorically effective in this moment. And then in that case, then, how do you link human rights? What a human right to what will be most effective in advancing the goals? Back to Varun's suggestion that the causal story needs to be clear and it needs to be specific. So how can you connect a human rights language to specific goals and to causal stories that make sense?
Yeah, I think that's the challenge. I'm very sympathetic to the equality-inequality framing as well, but I find I have a hard time articulating to myself what's an equality benchmark. You know, I mean, going back to some of the framing issues, do people really know what a Gini ratio is? You know, like 20% of the income going to the, going to the top 0.1, whatever. Do people really get that? And then on top of that, there's the question, there's the fact that people, when they think about inequality, say in some of these sort of lab economics games, they respond very differently when you're distributing money that's been given to you than they do when you're distributing money that's been earned. The outcomes are very different when you just sort of say in a dictator game, give someone some money versus you play a game and you earn some money. And I think that's at the core of some of the difficulties we have in thinking about inequality. There's a certain view that people have earned what they have, whether they have or not. People do think that people ought to have some right to own what they have earned. So that's, and obviously, luck plays a role, and there's arguments about the role of luck and that kind of thing, but I have a hard time getting out the real, the intuit, sort of how to sell that, I guess, I suppose. And then on the human rights side of it, I think there's, going back to some of the things I said earlier, one part of it, there's an overlap between human rights, the human rights agenda, as Sakiko described it in terms of transparency, participation, and the governance agenda, which has been on the, and pretty mainstreamed in development for a while now too. And governance is partly about power. And you could sort of say something about giving people power to make their choices, something along those lines, relating to information, relating to social connectedness. That would be one causal narrative. About having the resources and information you need to take care of yourself. And a lot of people obviously don't have that. So that's one route in. I imagine there are others, but I think that's certainly deserves more thought.
If I can suggest as a follow-up, last evening in the restaurant, we talked about in between equality globally and merely focusing on the bottom, there is the idea of relative poverty. So perhaps you can say something about, perhaps there is a more direct conceptual connection there between the human rights framework and thinking about relative poverty?
Yeah, what we were talking about last night over dinner, is this came up a little bit in the exchange this morning on Thomas's presentation of the World Bank's poverty lines. The lines are developed partly on the basis of the domestic poverty lines that people have established, the countries have established, in the world overall. And those are typically set at something like half of median per capita GDP in a country. Now, whether that's the right benchmark or not, it's not clear. I would prefer for the poverty lines, a global poverty line that's more relative in nature and not one that's based on simply do you have enough money to get enough calories in your body. But one that's based on sort of, as Adam Smith said, appearing in public without shame, to be based on poverty lines that are constructed with a decent or sufficient amount of deliberation. High-quality poverty lines would be the idea, that are technically accurate but also sufficiently deliberative in a country to make sense. And then if we had those, we could say something about what how a global poverty line might move as countries get richer. But now getting back to your, that was what we were talking about over dinner last night, but getting back to the question, clearly there's a relationship between dignity and appearing in public without shame. Those concepts are really quite close. And Smith spoke about the last, his story about the linen and the shoes walking around. And you need that to feel a sense of dignity. So I think there is a relationship.
Yeah, I would just actually say, Melissa, that there were 3 frames that were discussed. And maybe I didn't articulate mine very well. But yes, inequality and then human rights. But I also talked about human well-being, and I emphasized the importance of a positive vision and an inviting vision, a vision of possibility. And I think that's actually the way to do it. If we talk about, one of the limitations of human rights, with all and full respect for everything that has been achieved in terms of getting human rights into the SDGs, which I fully, I think it's fantastic that that's happened. But one of the inherent limitations is that they're progressive, right? That they depend on progressive realization. And by framing simply in terms of human rights, and my fear is that you essentially emasculate or disempower the necessity of immediate action now. And if you simply focus on inequality, then you do confront the reality that elites feel very threatened by that. And it also doesn't necessarily invite a positive a construction of a better system. And it's more of a kind of let's take what's mine right? As opposed, what's rightfully mine, as opposed to let's build a different way of doing this. So for me, the frame of a human well-being is a much better frame, and it can actually draw on human rights, and it can also draw on the core values that are actually in virtually every single preamble to every major human rights document. Dignity, human well-being, human worth, inherent worth, and so on. And I think that's, and you could also draw on inequality, overcoming inequality, and so on and so on. So it's a different way of thinking about it.
I'd like to apologize, first of all, for creating a confusion. When I referred to progressive realization, it was to make the point that human rights people don't deserve to be looked upon as totally ignorant by economists because they appeared not to understand scarcity of resources. So there's built into the human rights system progressive realization. Now that doesn't mean that rights can await indeterminately to be realized. In fact, in the authoritative interpretation of the International Covenant on Economic, Social, and Cultural Rights, it is made explicitly clear that there are between a half a dozen and a dozen dimensions of the right that are immediately applicable, one of which, and the first of which, is non-discrimination. So the concept of equality does not have to wait for any progressive realization at all. It is a legal obligation here and now. Those who have ratified, the 160 countries who have ratified that covenant, are bound by it at all times. Those who have ratified other treaties are bound immediately by those obligations. So it is that is an important clarification. Now, on the question, and you know, Jim, I value very much your views in this matter, but I've been grappling with the WHO definition of health recently and have reached the conclusion that is consistent with what Cicely Bock reached in her study on the WHO definition. Defined health as a complete state of physical, mental, and social well-being, using the concept of well-being, and an effort was made to add spiritual. And I will certainly acknowledge that if there was any improvement that was going to be made, I do side with those who wanted to add spiritual. But the concept of well-being proved to be so philosophically unmanageable, especially when preceded by the concept of complete, that most people who have put thought into it have concluded you can't really do much with this. It feels good, but it really has deep philosophical limitations. Whereas norms that have been defined through a process, the complex norm-creating process, and are subject to a process of monitoring to determine whether and to what extent states are complying with their legal obligations, lends itself more, including the right to health, which is also quite vague. The right to the highest standard of physical and mental health is the term. So how do we judge that? I think it's easier to judge that than it is to judge well-being. So this type of language I would prefer to see inserted in the post-2015 definition of the Global Development Agenda with the human rights sensitivity to it. But your question is the tough one, of course. How do you do it specifically so that it's not the window dressing that Varun was talking about? And that's where I think you need good people in the room to do it, like Sakiko and Varun and people like that.
Can I just come back to that? I feel compelled to offer some kind of rebuttal. You know, I can't remember who it was, but it was a great American philosopher, legal philosopher, who said that the law does not make us just in good, but protects us from what is not. So I think that's quite applicable in this context, in the sense that much of the prior tone, or the tone of the prior discussion we had this morning, was really about avoiding. It was really about the perils of an excessive technocratic approach to defining objectives and so on. And I think to a certain extent the same can apply to the idea of law. That if we simply define things in terms of their legal parameters, then we actually, in a certain sense, lower the standard of what is actually possible. And that's not to say that we don't refer to law, and that we don't empower necessarily, that we don't empower necessarily the core elements of law, like, for example, in this context, human rights. but that's not the aspiration. The aspiration is, and in a sense, it actually empowers human rights. It actually elevates human rights as a minimum standard. But the minimum is not the objective. The minimum is the minimum. We're actually looking for a condition of human well-being and human flourishing. And in that sense, that language, I would agree, remove the word complete, because that really is a bit much. But in the sense that it gives us something to aspire to, I think it's quite important, and that there is a common sense, that is a common aspiration. That's important. So
we have 5 minutes. Mira, you wanted to come in, and after that I'll take all the questions in a bunch and have them answered.
Yeah, actually, just building on Sakiko's point, human rights does need unpacking, and it's for us to unpack it and deliberate, and what goes in probably could address the dimensions that are incorporated. So the flourishings is something that is more engaging, and in terms of inequality, we frame it in a way that we engage with people rather than it becomes, if you just put in, it is a human rights frame, then that draws in divisions, or we have to frame it. So it's really a question about framing.
Well, I just asked Mitu, and she's given us 15 more minutes. So we'll have time for the questions. Sully, you were first.
Thank you very much to the panel. There are a few things I'd like to say about human rights, if I may. The first is that it's potentially extraordinarily powerful language. The way it's framed in the Universal Declaration, the popularity it's achieved, some of the marvelous examples of contesting human rights abuses that have led to successes illustrate the potential power of human rights language. But unfortunately, it's been undermined, often by those who claim most to be concerned about human rights, and there's several ways in which that's been done. The first is that it's very seldom acknowledged that there is no right without a correlative responsibility or duty. And we don't talk about those correlative responsibilities. Everybody claims their rights, but we don't define those who are responsible for making sure that those rights are delivered. And in the absence of speaking of responsibility, we have lots of people claiming rights, but nobody feeling responsible for attending to the rights of others. That's the first problem. The second problem is that if you read the Universal Declaration of Human Rights, the Universal Declaration says that all the rights are indivisible. Yet the majority of people who speak of human rights select those human rights that they want to emphasize or speak about most, and define the human rights according to those rights that they are most happy with. So, for example, in the USA, the civil and political rights dominate. And the Americans are very concerned about civil and political rights, but they don't recognize that they are not really being true to the Universal Declaration of Human Rights by selectively dividing those from the rest. The third is that, of course, some of the most vociferous advocates of individual human rights at the civil and political level have abused those rights themselves. They've been critical of other people abusing those rights, but they've not been sufficiently critical of themselves. And in abusing those civil and political rights themselves, they've undermined the language, they've undermined the power of human rights language. So that's been a concern. The other is that human rights abusers are always identified at the individual level. If an individual commits a human rights abuse, we want to identify that individual and punish or educate that person. But we don't pay any attention to the fact that most of the human rights abuses that we see in the world are implemented through systems that don't work, systematic abuses of human rights. And there's very seldom any attempt at defining the systems and the people to control the systems and to punish them for the human rights abuses that are subtended under the activities they pursue. And one example of that is giving corporations the right to be personas. So corporations have the same rights as individuals. They can move their resources around the world. They don't necessarily have the same responsibilities. They can't be held accountable in the same way. And many of the activities that are undertaken that result in the abuse of human rights of many people result from corporate activities. So those are some of the deficiencies in the language of rights. There's some other deficiencies. Michael Ignatieff pointed this out in his book, The Needs of Strangers. There's certain things that you can't get from rights. You can't get the right to be loved. You can't get the right to be treated with dignity. You can't have the right to have somebody empathize with you. You can't have anyone understand your fears and your concerns at the human level. So the language of rights has its limitations. It's a powerful language, but it doesn't do everything. We also need a language of needs. We also need an independent language of duties. If a parent brings a child into the world, that parent has a duty towards the child. If the child had to rely on the right of the parents to look after it, where would we get with that? If people didn't feel some sort of primary responsibility to their child or to their fellow human being. And I'm alluding now to some of the things that James has spoken to. The language of morality, the language of interaction, the issues that we need to address to respect each other and to give due dignity to everybody has to go way beyond the language of human rights. So the language is powerful, it's been used inadequately, it's been abused, it's been undermined by those who believe in it most, and it's been too narrow to deal with all the issues we need to deal with. So yes, I go back to say it's a powerful language. We should learn to use it more effectively, and we should be more sincere and more consistent in the way we should use it to allow it to have the power that it's got.
I fully applaud. I join in that applause for what Solly had to say. The concept of responsibilities in relation to rights is an old concept, of course, and anyone who studied law learned very early on that you can't study rights without concomitant responsibilities. And I'm always reminded of the effort that the that UNESCO made in 1947 to prepare the philosophical foundations for the drafting of the Universal Declaration of Human Rights, in which the Director General, Thomas Huxley, convened some of the world's greatest leaders and received a letter from Mahatma Gandhi, who reminded him of what his mother, his illiterate mother, had taught him, said that, I don't know much, Mr. Huxley, about, or Dr. Huxley, about human rights, but I do know what my mother taught me about human duties, and it starts with the human duties. The human duties are, in fact, incorporated into the UDHR in Article 29, and there have been specific references to this. Indeed, human rights do require the sense of duties, and I fully agree with you. I would hope that any approach to integrating human rights thinking into post-2015 MDG thinking would reflect the duties that are implied by all human rights. So I agree completely with you on that one. On the indivisibility, I'm 1,000% in agreement, and I devote a good part of my life to trying to bridge the gaps between those who are selective about human rights. That's one of the strengths, however, of the human rights regime, is that you do have, and we can call it doctrine because in a sense the UN is doctrinaire in this way in having the indivisibility and equal importance of the various categories of human rights. So there's a strong basis in the language adopted by all member states in resolutions that repeat this doctrine to remind countries that yes, you've got some real achievements on economic, social, and cultural rights, but damn it, let your dissidents out of jail. Or you, and this is especially true for the United States, claim to do a lot in the field of human rights. You rank it near the very bottom on respecting economic, social, and cultural rights as human rights. And in fact, the U.S. is one of the few countries that has refused to ratify the covenants on this. And on the broader moral framework, I agree 1,000% with you, Solly. Human rights is a social tool that has been used that serves a limited social purpose. But my whole point was to say that I think that limited social purpose has a place in rethinking the MDGs. It has a limited place. And I fully acknowledge the importance of appealing to broader ethical frameworks that people can adhere to. When appropriate, the strict framework of human rights can be reinforcing of a broader agenda. But that broader agenda can be our sense of promoting human well-being, promoting betterment of the human condition, all the things that we agree with. But I also think that Thomas has made a very important point in much of his writings, including World Poverty and Human Rights, which is to say that the basic structural injustices of the international system do, in a very strict sense of the term, constitute violations of human rights. Now, there's a certain power to that that is, I won't say superior to the power of saying it's unjust. Calling it unjust is powerful enough, but there's also an additional value to be saying, this is a violation of human rights. Let's look carefully at what that means. Let's unpack it, as you say, and see what it means. So I do agree with, I think, everything you said, Soli, but I want to press the point that within its limited framework, there is a positive role to be played by what has been achieved in human rights that can be used to reinforce a new direction for sustainable development post-2015.
We're going to try to get as many questions as we can, so let's do two at a time. Myron?
This isn't a question, it's a literature reference, and I think there is an important recent report that addresses precisely this conundrum that we're speaking about, and that's the report on social protection floor for a fair and inclusive globalization by an advisory committee chaired by Michelle Bachelet that was published by the ILO and the WHO. And I'll just read one paragraph from the introduction to it. The notion of the social protection floor is anchored in the fundamental principle of social justice and in the specific universal right of everyone to social security and to a standard of living adequate for the health and well-being of themselves and their families. And the report goes on to address the question of fiscal space, how this is going to be financed, and for comment on this, it was turned over to a team of people at the IMF who suggested a number of taxes and suggested that this, in fact, is feasible. And I think this is there's so many reports out there that this is a very hopeful one, and I think it's already feeding into discussion on the post 2015 MDGs.
Thank you.
I want to thank the panelists for their very good presentation. I have a question for Professor Orbinski, who did his presentation on global health and the well-being of people. I really like your idea of distributive leadership that emphasizes engagement with local people and taking into consideration values and beliefs of other people. But I'm wondering, what do you think could be the link between global health and the use of traditional medicine and informal health care in some parts of, let's say, Africa, where some of these practices are very important for people who do not have access to formal health care. I think for most time, there is the tendency to dismiss some of those practices as being very harmful. And I'm not contesting that. There are, of course, evidence which show that sometimes these practices exacerbate the health problems of people in some part of Africa. But I also wonder whether it has to do with a question of engagement of the providers of these services, and also whether it's a question of whether we should think about how to standardize the use of this traditional medicine and to regulate informal healthcare in those parts of the world. So I was wondering whether you could speak to that, whether global health has something to do with either dismissing those practices or regulating or standardizing them. And I also appreciate your link between climate change and how it affects people access to health care. And in this regard, I was also wondering whether you could speak to the fact that climate change, particularly natural resource extraction, could sometimes deprive people access to some of these traditional medicines. We have situations wherein people have, there are situations wherein mining companies deprive people access to land where they used to get this traditional medicine. I was wondering whether there could be a way in which global health could also speak to some of these issues.
We have time for one more question to collect. Yes.
I just wanted to touch on the idea of human rights language and how important it is, and it's something I would like to see the academic community continue to take forward with the new MDGs. I was working on social movement building last year with Rio Plus 20, and when I was reading Green Economy Transition paper, I was initially just a little bit bogged down in it, but the human rights language actually really resonated, and I found even with the social movement building work we did with the coalition of about 60 NGOs, pre and post Rio, that it actually amongst that body created a deeper sense of intensity and passion towards what we were doing by including what we basically managed to take a lot of people that were initially just there for green reasons and pull in the human rights reasoning, and it's because it was so intentionally used in the language of that policy. So, do it again.
Thank you.
So just very quickly on the questions around global health and traditional methods of engaging in healing, and also on climate change and health and resource extraction industries. I think what's very powerful here about the way in which this initiative is thinking is that there's an integrated approach, and I think health is part of that. I don't think that in a specific application that it is the responsibility of the doctor or of the healthcare system to specifically take on human rights abuses or negative health outcomes that accrue because of the extraction industry in Congo or elsewhere. But I do think it is the responsibility of the health community and health practitioners to participate in that process, right? And to make sure that they don't depoliticize health issues, and that they don't make health outcomes a non-political issue. They are political, and they are very much related to the economic structure of a nation, which is very much related in this instance to the tax strategies of governments in relationship to multinationals that engage in resource extraction. And they're very much related to the policies of, for example, the Canadian government and its current policy of supporting NGOs that work with extraction industries to offer health services. So, I mean, I think that's the approach that I would take. It's not that, for example, an organization or a doctor or a healthcare professional should explicitly be dealing with the resource extraction industry, but they must not explicitly deny their responsibility to engage in that political process. So that's the first thing. And then on traditional healers and traditional methods, we talk about traditional medicine and traditional practices in non-Western countries. But we don't talk about, for example, alternative therapies and alternative treatment strategies here in the West. They're very much part of our approach to health, and they're very much part of our understanding and our practice of creating health and well-being in our communities. So they're integral, and they cannot be ignored, and nor can they be denigrated. And I can give you many examples of initiatives that I've been involved in and I'm currently involved in that actually work with traditional healers and practitioners as part of an overall strategy within a community to deal with a particular disease or a particular health issue. So my general approach is very much, I think, in keeping with what you're actually suggesting, very much part of the thinking.
If I could also just quickly comment on the traditional healers issue. My colleague down the hall, Jishnu Das, has worked on private sector health providers in India, including many of whom use Ayurvedic and traditional medicine, and applied studies sort of saying, how would you deal with X, Y, Z to this situation, and finds that the knowledge base of a lot of the Ayurvedic traditional healers is just really not that high. And it's quite, it's an issue. It's a problem that needs to be addressed. And so I think that regulation is important, but at the same time, regulation and professionalization is always a two-edged sword. You upgrade professional standards, but then you create barriers to entry, and suddenly, these people are out of job because they don't meet the qualifications. So, I think that sort of bringing them in, is in a network, say like the Programa Saúde da Família in Brazil, where you sort of bring people together in teams. So it's sort of, I think that is right, but it's again, it's a governance question. How do you deal with the political economy, the power of the medical profession? But integrating, networking, regulating is the right impulse to me. And then the human rights, we can't keep coming back to this question. I think a lot of the points mentioned are really crucial. I think for me, the main takeaway is that human rights has a number of issues which I thought were well critiqued. It's not a Trojan horse for all of justice. It's been abused. You know, I was at a meeting with an ambassador to the UN from a country in the global south, and he said, look, we're all in favor of human rights, you know, but it was a country that's very supportive, but stop lecturing us, you know, enough already from all you countries that tell us what to do. So there's kind of a reaction to it. There's a tension in it between, say, property rights and anti-poverty rights. So it has lots of issues, but in some sense that's a mark of its success, you know, that people are trying to appropriate it, trying to fight against it. It's really a practice. You know, Charles Beitz has this argument about how human rights, it's not entirely coherent in some ways, but it's a social practice. And it's not this sort of, it's not only in a philosophical discussion, but it's rooted in what we do. And that's the part we need to draw on when we're using it for the MDGs or something like that, and draw on its rhetorical power. And what I was suggesting this morning wasn't necessarily to draw on human rights as it stands for the framing of the MDGs, but to use the way it draws on global memory as a model to build up a new kind of global memory when it comes to development.
Yeah, just following on that, what I would really like to see MDGs turn into, or these global goals turn into, but that hasn't happened, is that it's not appropriated by international development networks, or that it's appropriated by donor governments, but that it is appropriated by local communities to hold their own local, you know, subnational and national and international governments to account. I mean, it should be appropriated by people kind of at the lower level, so to speak, to hold authorities to account. And that, I think, is, to me, the spirit of human rights. The spirit of human rights as practice is the claim that you have certain rights, and therefore that those who in authority. I mean, so there's this relationship between the authority holder, so to speak, and people, individuals who have certain claims. And I think if we can use human rights in that way, not as kind of a legalized structure of accountability in which somebody takes you to court or something, you know. I mean, Varun has done all these wonderful studies that show that taking people to court over human rights doesn't get you very far. Okay, it's a more complicated story. So I think that the spirit of the practice of human rights is the ability to use certain standards, accepted standards, to hold authority holders to account, right? And I think that's the way that we should try to use MDGs. That's the process by which I hope that the global development goals would somehow become alive and answerable.
And on that note, let me thank our 5 panelists for an excellent discussion. Before we all go and grab coffee, sorry, just. So we'll take a 15-minute break, but just before we go to break, I've been told that we might present ourselves as being more put together and organized than we really are as an organization, and people might think that we don't need help. So I just wanted to ensure that no one misunderstands it. We are in dire need in order to pull all these, you know, Carissa, one of our volunteers, you know, helped us put that beautiful Prezi for the details our strategy for impacting the MDGs. We now need the experts and the people and the volunteers, from undergrad to master students to faculty.